Welcome back to the deep dive. We're here to plunge into a topic, pull out those key insights, those surprising facts, really, to get you well informed. And today we're tackling something called chronic venous insufficiency, or CVI. It
Mm,
sounds a bit clinical, maybe,
a little, yeah.
but it's actually far more common than you might think. A
Yep.
lot of people just brush it off as, oh, tired legs, or just getting older.
Exactly. It's often misunderstood.
So our mission today is simple. We want to demystify CVI for you, give you a really clear, concise handle on what it is.
Mhm.
We'll dig into why it happens, what signs you should look out for, and crucially, what can actually be done about it.
Right.
We've gone through the research, the sources to pull out those, essential nuggets. It's a shortcut, really, to understanding this without getting bogged down.
Yeah. Cutting through the noise.
And honestly, some of the things we'll uncover might just shift how you think about, well, your leg health in general. Okay, so to really get into the CVI deep dive, we have to start right at the beginning. What exactly are we talking about here? What is CVI?
Okay. So, at its most basic, chronic venous insufficiency is it's a condition where your veins have trouble doing their job,
Their job being.
sending blood back up to your heart. And this usually happens most commonly in the legs. It's fighting gravity after all.
Right.
Think about your veins having these tiny little one-way doors inside them, these valves. They're meant to stop blood from flowing backwards.
Like check valves in plumbing.
Exactly like that.
Yeah.
They keep things moving in the right direction, upwards.
Yeah.
But with CVI, these little valves, they get damaged, or maybe they just don't work right anymore. They don't close properly.
Ah, okay.
And when that happens, the blood doesn't move up efficiently. It starts to pool, usually down the lower legs,
Pooling. So it just sits there.
pretty much.
Yeah.
And that pooling leads to increased pressure inside those veins. It's like a traffic jam building up.
Mm-hmm.
And if that goes on, untreated, that constant pressure starts causing problems. Swelling is a big one.
Yeah.
But also skin changes, things getting thicker or discolored, and even in serious cases, open sores developing, ulcers.
Wow. Okay. So it's this failure of the internal gates leading to a backup pressure, gravity working against us. That makes sense. Understanding the why is always key, I find. So let's pivot. What causes this? Why do those valves fail, and who's most at risk?
Yeah, good questions. The primary driver is usually damage to the valves themselves.
Damage how?
Often, it's the result of a blood clot, specifically a deep vein thrombosis, a DVT. That clot can physically damage the delicate valve flaps.
Okay, a past DVT.
Right. Or it could be from a significant injury to the leg. Trauma can mess up the vein structure, but it's not always direct damage like that. Sometimes it's just long-term pressure.
Pressure from what?
Things like prolonged standing or obesity. That constant high pressure inside the veins can actually stretch the vein walls over time.
And that affects the valves.
Yeah, it pulls the valve leaflets apart so they can't meet in the middle and close properly anymore.
Ah, interesting.
And we should definitely mention varicose veins here. They're not just cosmetic. They're often a sign that the valves are already struggling. A common precursor to CVI.
So varicose veins aren't just CVI, but they can lead to it or indicate it's starting.
Exactly. They signal underlying vein problems.
You mentioned prolonged standing, so it's not just like a direct injury. Can your job, just standing all day, really put you at significant risk? Or is it always a mix of things?
It's often a mix, you're right. But yeah, prolonged standing or even prolonged sitting, the kind you see in certain jobs, definitely contributes. It puts constant stress on those leg veins.
Okay.
Other really significant risk factors include obesity, as I mentioned, pregnancy too.
Why pregnancy?
Well, there's increased pressure in the abdomen, plus hormonal changes that can affect vein walls. Then there's family history. If your parents had it, you're more likely to. Older age, because things just wear out over time.
Sure.
A generally inactive lifestyle doesn't help circulation. And smoking. Smoking is really bad for overall vascular health, including your veins.
So quite a list there.
It is. And, CVI isn't rare. Studies suggest it affects something like nearly 40% of adults over 50.
40%. Wow. That's much higher than I would have guessed.
Yeah, it's far more prevalent than most people realize, which is why awareness is so important.
Absolutely. Okay, so awareness is key. For people listening now, what are those red flags? What common signs should they be watching for if they think they might have CVI?
Okay, the most common things you'll feel or see, persistent swelling is a big one, usually in the legs or ankles, often worse at the end of the day.
Swelling, got it.
Then there's often an aching or maybe cramping or just this feeling of heaviness in the legs, like they're tired and weighted down.
Mm-hmm.
You might also notice that the pain tends to get worse when you're standing for a while.
Okay.
But, importantly, it often feels quite a bit better when you lie down and elevate your legs.
Ah, that makes sense with the pooling idea. Elevating helps drain it.
Precisely. Other things can include itchy or tingling sensations, sometimes called paresthesia, and of course, visible varicose veins are a very common sign.
Okay, those are the more common ones. What about more advanced signs? When should someone be really concerned?
Right, if CVI progresses, that backed up pressure starts to take a toll, especially on the skin.
How so?
You might start seeing skin changes, redness, sometimes a brownish discoloration, dryness, skin becoming thick or feeling kind of hard and leathery,
Mm-hmm.
especially around the ankles. Sometimes they call it brawny skin.
Bony skin. Okay.
And then in more severe situations, you can develop sores or ulcers. These are open wounds, often near the inner ankle, that are really slow to heal because the circulation there is so poor.
That sounds serious.
It is. And all of these symptoms, really, from the basic swelling and aching right through to the ulcers, they all tie back to that fundamental problem. Blood pooling and the increased pressure it creates. It's a direct consequence.
That really drives home why understanding that initial pooling problem is so critical. It just cascades. So, okay, someone recognizes these signs in themselves or a loved one. What happens next? How is CVI actually diagnosed? And then crucially, what's the range of treatments?
Diagnosis usually starts with a good physical exam. The doctor will look for those signs we talked about: swelling, skin changes, varicose veins, and he'll ask detailed questions about your symptoms and medical history.
Right.
But the key diagnostic tool is typically an imaging test called a duplex ultrasound.
Ultrasound, okay. Like for pregnancies.
Similar technology, yeah, but used differently. It uses sound waves to create pictures of your veins, and importantly, it can actually show the blood moving through them.
Ah, so you can see the flow.
Exactly. The doctor can see if blood is flowing backwards, identify which valves aren't working, measure how severe the problem is, and it's also crucial for ruling out other things, like an active DVT, a blood clot, which needs immediate different treatment.
Okay, so the ultrasound is pretty definitive.
It's the gold standard, yeah.
Then, once it's confirmed, what about treatment? Is it just surgery, or are there other options?
Oh, there's definitely a whole spectrum of care. It usually starts with the most conservative, least invasive approaches. Lifestyle changes are really foundational. Things like getting regular exercise walking is great, managing your weight to reduce pressure, and elevating your legs whenever you can, especially when resting.
Simple things, but effective.
Surprisingly effective for many people, especially early on. Then there's compression therapy.
The stockings.
Yeah, special graduated compression stockings. They apply gentle pressure, tightest at the ankle and less tight higher up, to help squeeze the blood back up towards the heart. They're a cornerstone of treatment.
Okay.
If ulcers have developed, then specific wound care is vital. Keeping them clean, dressed properly, sometimes specialized bandages or treatments are needed to help them heal.
Makes sense. What about more involved treatments?
If lifestyle changes and compression aren't enough, or if the CVI is more severe, there are minimally invasive procedures.
Minimally invasive sounds good.
Yeah, things like sclerotherapy, where a solution is injected in the bad veins to close them off, or endovenous thermal ablation using laser or radiofrequency heat inside the vein to seal it shut.
Heat sealing the vein.
Essentially, yeah.
Yeah.
The body then just reroutes blood through healthier veins. There's also phlebectomy, where the damaged vein segments are actually removed through tiny little punctures in the skin.
Wow, okay. Lots of options there.
And these are often outpatient procedures. Pretty quick recovery usually. Surgery, like vein bypass or putting in stents to hold veins open, that's generally reserved for the most severe cases where other treatments haven't worked or aren't suitable.
So it really sounds like a step-by-step approach, tailored to how bad it is.
Absolutely. Tailored to the individual's specific situation.
Okay, this is all incredibly helpful. Now let's get really practical. For everyone listening, maybe wondering, what can I do? What are the best steps someone can take to prevent CVI in the first place, or at least manage it better if they already have symptoms?
Yeah, the good news is there's quite a lot you can actively do. Prevention and management often overlap here. First off, stay active. Movement is key. Avoid just sitting or standing still for really long stretches. If you have a desk job, get up and walk around regularly. If you stand all day, try to shift your weight, walk in place, take breaks to sit with your feet up if possible.
Move more, sit, stand less. Got it.
Weight management is also huge. Extra weight puts extra pressure on those leg veins. So maintaining a healthy weight makes a real difference.
Right.
Diet plays a role too.
Hmm.
Eating a balanced diet, and particularly keeping your salt intake low, can help prevent fluid retention and leg swelling.
Low salt, okay.
And absolutely, if you smoke, quitting is one of the best things you can do for your entire vascular system, veins included.
Quitting smoking, always important.
Definitely. And finally, those compression stockings we mentioned. If your doctor advises them, even for mild symptoms or if you're just at high risk, wearing them consistently can be a really powerful tool for prevention and management.
So don't wait until it's really bad to consider compression.
No, they can be very beneficial earlier on too, under guidance. But maybe the biggest piece of advice is about early intervention. Know when to get checked out.
Yeah, when is that point?
If you start noticing persistent swelling that doesn't go away easily, ongoing leg discomfort like aching or heaviness, or especially any changes in the skin color or texture around your ankles, don't just ignore it or write it off.
Don't assume it's just getting older.
Exactly. Seek medical advice. Getting an early diagnosis and starting treatment, even if it's just lifestyle changes and compression initially, can make a massive difference in preventing those more serious complications down the road, like the ulcers or chronic skin damage. Early action is key.
That's a fantastic summary. What an insightful journey into CVI. We've really unpacked what it is, the mechanics behind it, the risks, the signs, and importantly, the whole spectrum of what can be done. A true shortcut to getting informed.
Hope it's been helpful.
Absolutely. And as always, we like to leave you with a final thought to chew on. Consider this. How might paying closer attention to those seemingly minor signals from your body, a bit of swelling here, an ache there, a change in skin, actually empower you to seek help earlier? How could that deeper understanding lead to more effective intervention, potentially heading off much more serious conditions before they truly take hold? It really highlights the power we gain from proactive health knowledge. Thanks so much for joining us on this deep dive.